Everyone has their eye on these monkeypox cases that have been popping up around the world and right here in the United States. If you have the disease, you'll know. It shows. One of the symptoms include a painful rash that spreads across the body. Experts say this latest outbreak was likely the result of two people having sex at a rave in Europe. Bastards. We want to be clear, monkeypox isn't an STD, but Dr. Danish Ali tells us the infections can likely happen from getting it on.
What the hell, Dr. Ali? We're talking about monkeypox now in the United States. First of all, establish to us exactly what that is and why we have to be concerned about something I thought was long gone.
That's correct, Isaiah. And it was, and it has been long gone. We were seeing very little amount of cases originating from Africa, and it was pretty much a controlled disease. However, up until recently, we have now seen that this virus has spread to different countries across the world. Those being the European countries, and most recently it has spread here to Massachusetts and New York, where we are now seeing those cases as well.
So what exactly is monkeypox for those who are not 100 years old?
Yeah, Isaiah, this is a virus that originated in 1958. It started in the monkey species in West Africa, and it spread there, and it was spreading very fast up until when a vaccine was developed for it. And the whole world essentially got vaccinated for the most part, and we were able to get rid of this in its spread. And so 1980 is when the CDC stopped issuing the recommendations for those vaccines. And we've been doing well up until recently, where now we've noticed the spread out of the Africa and into different parts of the world. What's alarming is, Isaiah, that we do not know the relationship and the correlation between the cases there and the cases here. There has been no documentation of travel from Africa to different parts of the country that we can put that tie together and say, this is where it originated from, and now this is how it spread. So that's still being conducted as we speak.
Now, bottom line, how it spreads is through sex, though, right?
That's correct. Bodily, yeah, bodily. So kissing, making out, any sort of bodily touching. That's how it's spread, and sex is, and that's where a number of those cases. There was some party in Europe, a rave party, where folks had sexual contact, and there's many cases that have originated in that party that was had at that time.
Now, once you get it, is it treatable? Do you take the vaccine after you get it, or do you treat each issue that you may have?
So both, Isaiah. So there is symptomatic treatment. So if you've developed the lesions or fever, chills, you treat them symptomatically, number one. Number two, yes, there is vaccine, and you do get the vaccine as well. But it's very important because the initial symptoms present like a fever or flu-like symptoms. And so if you develop any lesions or any swelling of the lymph nodes, that is important for you to go get checked out, very important for you to get checked out to make sure that this is not what we're talking about here.
And I think I heard a report last week where many of those lesions and the boils or whatever you may see on your skin can go away in as soon as 4 weeks, right? If you're properly treating it.
That's correct. This is a viral illness, Isaiah, that generally takes about 2 to 4 weeks, of course, and most people do fine. However, there is that 1 in 10 folks that die from this, and those are the folks that we are trying to prevent and trying to catch this early, trying to give them the vaccine and treat them symptomatically as well.
Now, for those who say they want to stop it early before they even see it or get it, is that vaccine even available anymore in America? Or
yeah, not yet, Isaiah, but there are discussions being had right now at the CDC level. Some of the manufacturers have already developed and are developing currently stocks of this medication in case this does spread like we saw with COVID and others. that we may need to, eradicate this once again, or if it starts spreading very fast, there are those vaccines that are currently being developed by these manufacturers.
So what precautions would you tell the viewers to take to try and ensure they don't get it?
Yeah, if you're sick, if you've developed any flu-like symptoms, get checked out, practice safe hygiene. If you're practicing sexual contact, practice, safe measures. And if you're not feeling well, get checked out.
All right, Dr. Danish Ali with Arch Point Pain Institute. Thank you for joining us here on The Factor Uncensored to give us the latest on this monkeypox. Thank you, sir.